Hi, my name's Claire Davies. I'm a physical therapist in Lexington, Kentucky, and I'm at a community hospital. And today I'd like to talk to you a bit about scar tissue following breast cancer. Now, this is an important issue to be looking at and preparing for either pre-op or post-operatively. In the pre-operatively phase, it's really important to be thinking about um, what the chest is going to look like following a mastectomy, lumpectomy, or other considerations for going on to have reconstructions. So, as a patient, it's important for you to start thinking about what treatment are you having, what is your surgery going to involve, what are you going to have radiation? Are you going to have reconstruction? There's a lot of questions that are out there that are important to consider and be aware of that surgery, radiation, and reconstruction all have side effects of scar tissue. And noticing if there's any tightness, pain, restriction across your chest after. And some people complain to me that they have a tightness in their drain site or where the incision was, or they can't lift their arm up high enough. They may even say that they've just got pain and this tightness and it feels like they're in a cast of armor and it feels like they can't breathe. You feel restricted and it goes like a band across your chest, and sometimes people say it goes all the way around the back as well. So if you're starting to identify those kind of feelings, it's important to get to your physician to get a referral for a physical therapist if you don't have direct access, or if you do, go straight to your physical therapist. Now I want to talk a little bit about reconstruction because people are coming to see me during the phases of reconstruction and going through that expansion phase. So I will see women either after surgery, 3 or 4 weeks after, before they have radiation. If you can't lift your arm up high enough, you may need to come to see me to get your range of motion back so you can actually go and have radiation. And then I'll either see you before you are planning to have your reconstruction. Our local plastic surgeon will send people to me to have the scar tissue prepared before she starts filling the expanders if you already have them in place. And I will then follow you through that course of expansion. I'll see you the day of your expander fill. I'll work on the scar tissue before you have that fill. And then once you're done with all your fills and you have had your surgery, you may come back again after the expansion phase and the replacement of the expander with the implant. You may have some scar tissue following that, and you may again come for physical therapy. So that's kind of the course. It is a long process, especially if you're having reconstruction, so be patient. But if you notice early on you're getting some tightness and pain, it is really important to notice that and get early intervention. I am going to talk about something called A-stim therapy, and if that is not available in your area, please go see your physician and get a physical therapy referral. Physical therapists can do a lot of different techniques to help break up scar tissue. It doesn't have to be A-stim therapy, but that's something I have had the opportunity to work with and know it helps. And I have used it a lot over the past 5 years, and I have specialized using that technique. But there are a lot of other techniques out there, and I don't want people to focus just on the one. The biggest thing I want you to do is go see a physical therapist or occupational therapist or whoever is in your area working on scar tissue. There are some slides to go along with this, so I have now posted a picture of the ASTIM tools, and I'm going to talk a little bit about ASTIM therapy now. It's a process of restoration. It allows the scar tissue to remodel itself. You increase circulation to the area, bringing in brand new blood cells. As you use the tools that you'll see in the picture, you gently go over the skin with those tools, using cocoa butter or some kind of moisturizer, vitamin E cream, or whatever people use. It then helps stimulate that tissue to heal itself and the scar tissue to be laid down in a more natural position for the range of motion and function that you're going to be doing. It is important to combine ASTIM therapy with other scar tissue massage techniques as well as therapeutic exercise to gain your movement back, your range of motion, and it'll help improve function, which will help your quality of life. As you can see, using those tools, ASTIM therapy is a non-invasive soft tissue therapy. It goes over the skin. It doesn't go into the skin, and it doesn't open up the skin. The instruments you hold with your hands, and there's 3 different ones that you will run over the skin. And again, it locates any of that scar tissue under the surface. It's not a deep tissue. It's very, very superficial, and it's very gentle. And you, as you push pressure through the tool, that pressure goes through the instruments into the skin. Like I said, it's very gentle, but that same day you might have a little bit of tenderness later on, and that's normal. It should settle down. Now, sometimes it does stay tender for a few days, and if that should happen, then normally as a therapist, I would say come back in a few days. Normally I get people in twice a week, but if it's too tender, I might say come back the following week, or we may have to leave it 2 weeks. Scar tissue breaks down over time and builds up and forms stronger tissue over time. So you may not get to go every week. It might be once a month, once every 2 weeks. It varies on how you as an individual tolerate the technique. So when to get started with therapy? I always recommend 3 to 4 weeks after your surgery. And my physicians here where I work refer people very early. So they will see them 10 days following for the first post-operative meeting. And then you're either identified then as you may need physical therapy because your range isn't quite as good as it should be. Or they may wait, it might be 3 or 4 weeks down the line that you go back to see your doctor and you'll be referred then. But the earlier the better, but I don't see anyone before 3 to 4 weeks because that scar tissue needs to get healed and lay down, and your incision needs to be closed up. Like I said, if you've had expanders for reconstruction placed in, which is very common in the area that I work, I will wait 3 to 4 weeks after that before we start treatment. Same with radiation. Following radiation, and if your tissue is tight and you have restricted motion, you won't get sent for about 3 to 4 weeks. I want that tissue to calm down before I start this treatment. If your chest is red, hot, swollen, and you may even get feelings of chills, fever, aching, that is a sign of cellulitis, some kind of infection. It is really important for you to go back to your physician and not come back to me as a physical therapist, because you more than likely need antibiotics for an infection. So if I see any signs of that when you come to see me for your treatment, I will send you straight on to the physician without doing any kind of treatment that day. The antibiotics in that case are more important. If there's any open areas, blistering from radiation, again, I won't start treatment at that time. I will wait for those to heal up first and be healed a couple of weeks before I start with any hands-on therapy. So again, I'm going to reinforce ASTIM therapy as an extra tool to go along with other physical therapy or occupational therapy treatments. Another thing I want to talk about that I find really important in my practice is body image. And this is another area to identify early on, how you feel about your surgery coming up, how you feel about your body, and your adjustment to how your new body is going to be. When you have a mastectomy, what we do at our hospital is before you have surgery, we offer counselling for both you and your family. And we've identified that from patients who have said that they need to go talk to someone out of their immediate situation, or they need help for the family to adjust to this new diagnosis and their surgery and what they're going to look like before and after having the surgery. So we've identified people, and women have come forward and said, yes, I would like to go see someone and talk with them first before I have my surgery. And that is happening. In the office with the physicians, the surgeons, they are showing women before and after pictures of other women who have agreed to have these pictures shown to show you what the scar is going to look like if you're not going to have reconstruction. If you are going to have reconstruction, you have a plastic surgery consult. And again, she goes through multiple pictures of before and after pictures to help prepare you mentally for how things are going to look after. It's very common here to have implants. Occasionally, you'll get other surgery, tram flap or latissimus dorsi, where they take the muscle from your back and bring it forward. And again, if those are the surgeries that you are preparing for, they will show you pictures if that's what you want before you go and have your surgery. What we have found here is that it's really important to identify from the individual, and you have to help tell your surgeon or your plastic surgeon or your nurse navigator what you feel you need as you prepare for surgery. So if you need to see a video, some people have asked to see a video of the surgery. We have been able to help you with that. There are books, there are pictures. Some people have said absolutely not. They don't want any kind of pictures or see anything before they go down for surgery. And that's been fine too, and we've accommodated that. Some people have asked to talk to other women who have had that surgery, or other women support groups. Can they go to a support group beforehand? And if they're available in your area, or you have someone who has been through this surgery, at our hospital we pair you up with someone so they can kind of be a mentor and help you with that and help you process things, because you have so many questions, and sometimes as healthcare providers we forget. We're so used to helping people through this process. Some of the simple questions we may not go over. So please, please, please ask questions. I hope you have a nurse navigator who helps you through the system, but that's not always the case. And that's someone who meets with you when you go to your surgery visits. And she may be someone you confide in. A lot of my referrals to physical therapy have come through our nurse navigator, because one of the patients has said, my chest is feeling tight. So she can get that referral for you as well. So it takes time. Time is needed for the adjustment to the new body image. And following from that, I've started to collect and ask people, patients, as they come into my clinic, about restrictions in clothing. I am seeing, or patients are reporting, that they have issues wearing a bra after surgery. Bras don't fit right, the prosthesis doesn't fit right, it's heavy, the bra doesn't fit right, or they can't tolerate it on their skin. It feels prickly. The skin, you'll wear your bra for an hour, then you have to take it off. It gets tight. It feels like it's swollen. Again, it feels like there's a band across your chest. You're not alone. This is very common. Most of my women, this is their biggest complaint after surgery, is they can't find a bra that fits, or They can wear it for when they have to go to work or go out the house, but as soon as they get back into the house, they tear it off, they take it off. They can't stand something touching their chest. And that's because the scar tissue is very hypersensitive and it needs desensitizing. And again, manual therapy, A-stim therapy, working on that scar tissue and you touching that scar tissue is really important. I teach all my women how to massage across the front of their chest to help with desensitizing so that you can tolerate wearing a bra again. And that's something very simple, but following surgery, it's a really hard thing to do. And we're starting to notice that if you can't wear a bra or it doesn't feel right, it's affecting home life, it's affecting work life, sexuality, as well as women aren't participating in exercise. So identifying this and getting treatment for this early is very important. So some of the things I was seeing, apart from tolerating fabric on the chest, is actually being able to touch your chest yourself or letting someone else touch it. That is a very emotional time. I have women come to me 6 months after surgery. They haven't touched their chest. They can't look at it. They cover it up when they go in the shower. And it is very important. One of the first homeworks I will give you is to go get some moisturizer cream, vitamin E, cocoa butter, and rub that across your chest and get that scar moving. It helps you reprogram your brain to show your new front line so that you know where the front of your chest is in space. And that's a very important thing. Some people say they get too close to people when they hug them. They knock into doors because they don't know where their new front line is. So it's very important to work on that and help you develop a desensitization so that you can feel the front of your chest again. So looking at the scars is very difficult. And again, using a mirror, having someone with you the first time you do it is very important. Women have reported feeling less feminine following having mastectomy because they don't have the breasts, and that's an indication that you really need to go see some counseling because that's out of the help I can give you. So I will refer you on to a counselor to help you process that and adjust. Some women have also said they don't like others looking at them. And again, that's a natural process. And again, I would refer you for counseling to help you work on that alongside with coming to physical therapy. So it's a team approach, and that's the way it should be. So on the slide now, you will see a clothing restriction questionnaire that I'm starting to develop and trying to figure out what are the best questions. Are they getting at some of the restrictions women are having? But this is what I've started asking my patients to help me score at the beginning of physical therapy and then again at the end and see where we are in that process of adjustment and if the A-stim or the exercises and the manual therapy that I'm doing, if it's making a difference or not, and whether you're able to wear a bra at the end of our treatment over a course of 4 to 6 weeks is not about normal. That I have had people come back to me and say, yeah, you know what, I can wear my bra now and I feel more comfortable. And I feel more confident when I leave the house and go out and see others, and I can get used to them seeing me now. So addressing this early is very important. So key points: recognize you have a tightness across your chest or it doesn't feel as flexible as you want, and seek early treatment with physical therapy, occupational therapy. If the scar tissue progresses, it can get tighter. So the early we can get in to help teach you about self-management and looking after this tissue and getting it moving, the better outcome we'll have, because this is going to be an ongoing process. You're going to be working on this tissue and your chest to help desensitize it for a while, and it needs to be part of your ongoing daily routine. So the earlier we can get it part of your routine, the better outcomes that I've seen. I have on the slides included my contact. So if you do have any questions, please let me know and I'll try and answer them as best I can. The other contact I've given on the PowerPoint is ASTIM therapy. It's important that you go on their website, you understand what that treatment is, and you look to see who can provide that locally. Unfortunately, it's probably only going to be available to those in the United States at present, but it's important that you contact them or talk to them to see where your local resource for that is. Again, early intervention's key. I hope you have learned something from this, and please, if you have any questions, email me, let me know. I appreciate your time. Thank you.